Right. So Bridget, who was one of my colleagues, had actually met you at one of the conferences, and she was blown away at what you're able to accomplish. And that's the thing that's the part of it that really intrigued me is that it's truly just coming from your own body.
Yes.
And yet there's still other things out there. Now, PRP has been out there for quite a while. I used to hear about it when people would have any specific kind of tendon injuries or joint injuries, and the orthopedists were injecting it, and they were getting mixed results. But for the people out there, what's the difference between PRP, PRF, and maybe we should even throw in what's the difference between all those things and exosomes as well? Uh,
Yes, and I'm very passionate about those. And again, you're right. PRP, PRF, exosomes. PRP was kind of our original forefront. We take our own blood and spin it, and we pull off the platelet-rich plasma, and then re-inject it. It's started kind of a nice way to help enhance the skin. Sorry about that. Enhance the skin. Better. I know dentists are using it, eye doctors, a way to take your own blood, your own product, and re-enrich and rebuild collagen and re-fertilize, shall we say, the body. PRP is great. It has about 6 to 8 growth factors in it. And those growth factors, when re-injected into, the body or topically applied, help encourage the body to regrow collagen. After we hit about 20, 21 years old, we start losing 1% of the collagen in our bodies. And so this was a great forefront to start helping replenish it naturally. I myself experienced some PRP injections in some joints, my knees and my shoulders, that I had some accidents from horses with. And I got relief and was able to not have to use steroids anymore. So that kind of started my kind of belief and career in it 10 years ago with that. And then it's just, we've now progressed on to PRF, which is something else.
Before we go on to PRF, so PRP essentially has these substances in. So basically, you would take a tube of blood, you put it in a centrifuge, you'd spin it, and usually you'll see a separation where there's sort of red blood cells on the bottom and more yellowish serum type stuff on the
Yes.
top. And some portion of that is where PRP comes from. So the people would suck that out of the tube of your own blood, and they would inject it into wrinkles, skin, into tendons, into cartilage, into joint spaces,
Yes.
and all of these wonderful things can come out of it. And of course, it also was used in the sexual wellness arena as well. And
Yes.
would you say that the results were always there, or it was sort of mixed results with PRP?
I would say that with PRP, there was always some kind of improvement. And this is kind of where we'll dove off to exosomes in a while. There is a part of it that, the older we get, we don't have as many growth factors, or they're not as healthy as they were when we were younger. So we were striving to look for something that maybe gave us a little more consistency in the outcomes for patients, because yeah, depending on the patient, would be kind of a little bit of their result. If you're 70 years old giving your own blood to try to remake it, then you get some growth factors in there, but again, they start to diminish and aren't as healthy of the ones as when we were younger. So like I said, PRP, we did it for all of that, and we did get results, but inconsistency, I would say, somewhat, based on age or how healthy the person already was. So, that led science, I think, to look a little deeper. And just like everything, it evolves.
So that's how PRF sort of came on the scene.
Yes.
How
Yes.
did they discover that just by going to a deeper layer of that serum separation that there was something more that
Right.
happened?
So, not list all the scientists in the world, there's several people that have been studying it. And one in particular is Dr. Myron. He is based out of Jupiter, Florida. He is actually a dentist. Well, he's many things, so I don't want to just leave it at that. But and he researched, the need from PRP to PRF, and found that a non-fixed centrifuge, with no chemicals in the blood vials, preserved and gave you PRF, which is the thicker, very bottom ml or 2 mLs of a syringe now, or of a vial. And he studied it and found out that there was, more growth factors, some mesenchymal stem cells, some neutrophils, leukocytes in the CPRF. And he also realized that he could then go and take that top layer of the PPP and PRP that was then in that tube and could turn it into a filler, your own natural filler. Then he discovered you could take the CPRF and mix it with the biofill and activate it and actually get 14 days of, shall we say, fertilization, uh, growth factors to help increase the improvement of the consistent outcomes. And it started, using it in joints also, but primarily, I mean, my favorite thing with it obviously is anywhere, but I like the fact that I now use it in teaching to, for everybody use it as a filler, a natural filler. So then instead of the Juvederms and, Allergan, and again, those are all great too, but why wouldn't you want your own filler in your body that is going to replenish and put collagen back in? And, there's a lot of risks with.
And honestly, I think that was the most exciting part of when Bridget had told me about when she first met you, is that, we're coming from the functional realm.
Yes,
We're both from the conventional medicine realm, and realize that there's a lot of things that we could be doing that are closer to natural. And
yes,
to actually have the ability to take something out of your own body and be able to do things from an aesthetic perspective, from an arthritis perspective, yeah, and even from a sexual wellness perspective, that's just blows my mind. And to understand that you even have your own stem cells in this product that are helping. So, in comparison to PRP, you would say PRF has how many growth factors?
So if you're talking PRP, well, let's pretend like we've got the same age, same, say let's take a 40-year-old patient. If there's 6 to 8 growth factors in PRP and there's close to 200 in PRF, that's a huge difference. And again, you're getting a little bit of mesenchymal stem cell, you're getting some other wonderful nutrients for your body that you can't get from PRP.
Right,
So
and these are all through a local use. In other words, you would inject it to a specific
yes,
area where you're looking to do these things. And
yes,
when we had talked in the past, even when it comes to the specific joints, when you get really close to the area that you need, not even specifically in the area, the growth factors know that something is needed in that area, which is pretty impressive. Um,
exactly.
so it's the growth factors, but then the other piece that I found amazing is that you can use those upper layers that you got out of the centrifuged blood, and you can make a fill where you
Yes,
actually are making things plump,
yes.
and you're sort of spurring on the environment for your own natural collagen production to occur. And I thought that blew my mind when I found out you can do that kind of stuff. So
Yeah, it's fascinating and amazing. It's going in and neocollagenesis and helping your body. We are born, we mature, and then we age. So as we age, we start to lose our younger self, shall we say, in all aspects, all realms, whether it's joints and health and sexual wellness and just aesthetic as appearance. So then to have something that we can use from our own self and put back into ourself that's totally you is amazing. And then getting the results, is there some question like, oh, how long does it last, and if you've got a filler versus a PRP or a PRF. But honestly, it's all in your treatment. You might need 1 or 2 treatments and maybe 3 at the most, but again, not only are you filling and replenishing, you're actually helping repair and help for longevity, and it's all you, and you don't have to worry about the chemicals that you're ingesting.
yeah, so I mean, in those clients that are always concerned about certain kinds of pharmaceutical grade medications, or even these fillers that are not really coming from you, they're coming
Right.
from external sources, this becomes a very viable alternative.
Yes.
And so when you're so if an orthopedist is telling you go get a steroid injection for a joint because you're having a lot of discomfort there and maybe there's some arthritis there, we're looking at an alternative that not only takes away inflammation but helps to rebuild the area. And to
Absolutely.
me, it makes sense that you would want your body to try to get signals to repair itself and not necessarily just squash inflammation and in the end with repeated injections cause even some bony
Oh,
problems in the
yes.
joint that you're working on. So it's really impressive to me. Do you think that the same holds true with PRF when compared to PRP in terms of the more advanced your age is, the fewer growth factors, or do you find that you start to get more consistent effects with PRF compared to PRP regardless of age?
So a couple things. With the PRF, because you can make the biofill with it, so you have your PRF, but you can also make the biofill. When you're talking joints or some sexual wellness, you're kind of putting a cushion in with it too. So, PRP, you're putting it in and it dissipates and it disperses quite rapidly and it knows where to go, as does PRF if you're using it as a liquid. But if you're mixing and putting it with your filler you're making from it, you're also so you're getting it to stay longer. It's giving you a good 14 days of nutrition during that neocollagenesis time. So yes, you are, even for the older patients, we're still getting better results with PRF and longevity than we were with PRP.
Right, right. And, I
So
was speaking with Dr. Fromm in Manhattan, who is really sort of advanced in his oral surgery. So there was an issue with the tooth, and you can use this PRF to actually fill an area and spur growth. And it's being used in so many different areas. Again, you're using your own blood product to spur growth, as opposed to some people who are concerned about getting bone grafts, some people
right,
that are concerned about getting a foreign tissue put into their body. No matter how much it's been bleached by the pharmaceutical industry, it just sits better with people when it could be their own body that's creating that healing.
right.
So